Knock, knock. Hi, my name's Eric, and I'm going to be the nurse who will be doing an abdominal, neuro, musculoskeletal, and integumentary assessment on you. So, can I have your name and date of birth?
Abigail Drace, 12/8/99.
Good. Patient has been identified for positively with two things. So now I'm going to wash my hands and perform some hand hygiene. And now I'm going to lower this and put your head down. And I'm just going to have you lay down. Alright, so now I'm just going to listen to your abdomen for 20 to 30 seconds in each spot I listen for, and 3 times in each quadrant. All right, you have bowel sounds in all 4 quadrants of your abdomen. So now I'm going to palpate your abdomen, and I want you with a little bit of light pressure, and I'm going to be feeling for any kinds of masses. Does any of this hurt?
No.
All right. Still not?
No.
Good. All right, no masses or anything else noted on palpation of abdomen. So now I can have you sit up. And now I'm just gonna inspect at all your joints, looking for symmetry, deformation, tremors, or color of all your joints. No abnormal colors there. So now I'm just going to palpate your joints now to feel for any other deformities I can't see. Hands, knee. Alright, you have no deformities when I palpated all those joints. So your TMJ, neck, shoulder, elbow, wrist, heads, well, your hands and feet. So now can I just have you bend over and touch your toes so I can palpate your spine. Paraspinal muscles are not spasming and are of correct size for patient. So now I'm just gonna have you test your range of motion for your body. So what I'm gonna do first is I'm gonna press down on your shoulders, and I want you to shrug again. Good. Now I'm going to do the same thing for your knee. So I want you to kick your knee out like that first, and then after that, when I move my hand, pull in. So for kick out against me, good. Now pull in, good. Same thing with this leg, kick out, good, and pull in, good. Full strength with resistance in the knees, full strength against resistance in shoulders. So now I'm going to test the range of motion in your elbow, and then we can do your hip. All right, so flex, good. Now extend, other way, good. Flex this arm, good. Extend, good. Your full strength against resistance and can move against me, which which means you have full strength bilaterally and symmetrically on both sides. So now I'm going to have you hop off the exam table. You should hold on to it for your balance. And I'm just going to have you do a couple of kicks for your strength and range of motion. So for your outside leg, we're going to do that one first. I want you to kick out, good. Now I'm going to push down against you, and I want you to resist me, okay? Good. Now flex it, and I'm going to try pulling against that. Go against me. Good. Now I want you to kick out and push against me. Good. Now pull in against me. Good. Adduction, flexion, and extension of the hip is full strength and normal in the left hip. Now you can turn around and we're going to be doing the same thing. Push against me. Pull against me. Good. Now kick out. Good. Now pull in. Good. So on your right hip, you have full strength and full range of motion of your hip. So now you can have a seat, and we're going to move on to your neuro exam. So first thing I'm going to do is I want you to put your finger on your nose, and then I want you to touch my finger a couple of times, okay? All right, patient is exhibiting eukinesia and is able to have spatial awareness. Now I want you to rapidly, so first rest your palms on your knees, and I want you to rotate it as quickly as possible. Rapid movement also indicates good motor function and movement, purposeful. So now I'm just going to do a couple of your deep tendon reflexes, okay? So I want you to put your arms out, and I'm just going to do a good tap. There we go. 2+ on the left patella. 2+ on the left patella. Both patellas are equal and bilaterally able. So now I'm going to test your bicep reflex. And patient is positive for the bicep reflex, 2+. And left bicep is 2+. All right, so now I'm just gonna use the back of this reflex hammer, and I want you to tell me, so I'm going to show you, I want you to tell me whether it's a sharp thing, so feel like this, or dull like that. All right? Feel like you can do that? All right.
Sharp. Dull. Sharp. Dull.
All right, turn your hands over.
Sharp. Dull. Sharp. Dull.
Good. Now your feet.
Sharp. Dull. Sharp. Dull.
Patient peripheral sensory is intact, as she is able to differentiate between sharp and dullness. So now I'm just going to test your cranial nerves. So the first thing I want you to do is close your eyes and tell me what this smells like.
Mint.
Good. Cranial nerve 1 is intact. So now I'm just going to shine a light in your eyes a couple of times. Direct and consensual response are positive on patient. I'm just going to have you look out at that wall right there. I want you to focus on it. Now focus on the tip of my pen. Good. And patient also is capable of accommodation, so as her pupils dilate when looking at close objects and track them. So cranial nerve 2 is intact. Now I just want you to look at the tip of this, and I want you to follow it best you can, okay? Patient is able to follow all 6 zones of the 6 cardinal movements of the eye. So cranial nerve 3, 4, and 6 are intact. Now I need you to close your eyes and I want you to tell me where you feel me touch, okay?
Left forehead, right forehead, left cheek, right cheek, left mandible, right mandible.
Cranial nerve 5, trigeminal nerve is intact as she's able to sense in all 3 branch locations of her trigeminal nerve. Now I want you to smile as wide as you can. Smile is symmetrical and no drooping is noted, so cranial nerve 7 is intact. Now, what I want you to do is close your eyes and I'm going to rub my fingers and I want you to tell me which side you hear it on.
Left side, right side.
Hearing is capable, so the sensory part of vestibulocochlear is intact. Now I want you to follow this and I'm going to move side to side. Patient exhibits negative nystagmus, so cranial nerve 8 is intact. Now, I'm going to ask you to do 2 things. I want you to stick out your tongue and say ah.
Ah.
Patient is able to stick out tongue and say ah without any sign of hoarseness or any kind of asymmetry with her palate. So cranial nerve 10 and 12 are intact. And now I'm going to repeat the same shoulder test, which is to test cranial nerve 11. So push against me, full strength bilaterally on shoulders. So cranial nerve 11 is intact. Now I'm going to move into your integumentary assessment. So right now, staying right here, I have not noticed any unusual odors on patient, and I'm just going to take a look at your skin. And the patient's skin is warm to the touch and a little red, but by and large, color is usual for ethnicity. No scars, moles, or lesions are noted on the patient, and you don't have any kind of skin breakdown, right?
No.
All right. So now I palpate for texture and turgor. Turgor is good, indicating patient is well hydrated. So I'm all set. You've done well. Everything's normal, so you're not special.
Thank you.